good morning. Our topic is about analgesics. So, what are the objectives of this topic? The objectives is to be able to describe the different drugs classified under analgesics, the effect of the different drugs on the body, and the contraindications of each drug. What are analgesics and why is it important to demonstrate? Analgesics, it is also known as painkillers. It is any member of the group of drugs used to achieve analgesia. These drugs that relieve pain due to multiple causes. Analgesics classified into two main groups. The first is opioid or the narcotic analgesics, and the second is the non-opioid analgesics, which are the non-narcotic. Non-narcotic analgesics are mild analgesics and effective in mild types of pain as headache, toothache, and etc. These act on the level of the thalamus and hypothalamus. It is used to lower the elevated body temperature. Mechanism of action refers to the specific biochemical interactions through which a drug substance produces its pharmacological effect. Non-steroidal anti-inflammatory drugs or NSAIDs is a class of analgesic medication that reduces pain, fever, and inflammation. Aspirin is used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, and headaches. It may also be used to reduce pain and swelling in conditions such as arthritis. The common side effects of this drug are upset stomach, heartburn, drowsiness, or mild headaches. Non-acetylated salicylates. This includes magnesium choline salicylate, sodium salicylate, and salicyl salicylate. This drug gives to patients who have asthma and bleeding tendencies due to they inhibit platelet aggregation. The administered in doses up to 3 to 4 grams of salicylate a day and monitored using serum salicylate measurements. Celecoxib, used to treat pain or inflammation caused by many conditions such as arthritis, ankylosing spondylitis, and menstrual pain. This drug do not use before or after heart bypass surgery or coronary artery bypass graft or CABG. This may also cause stomach or intestinal bleeding, which can be fatal. These conditions can occur without warning while you are using celecoxib, especially in older adults. Do not use celecoxib if you are allergic to it or if you have bleeding in your stomach or intestines, an allergy to sulfa drugs, and a history of asthma attack or severe allergic reactions after taking aspirin or an NSAID. Meloxicam used to treat pain or inflammation caused by rheumatoid arthritis and osteoarthritis in adults. Do not use this drug if you are allergic to it or if you have ever had an asthma attack or severe allergic reactions after taking aspirin or an NSAID. Diclofenac used to treat mild to moderate pain or signs and symptoms of osteoarthritis or rheumatoid arthritis. The Cataflam brand of this medicine is also used to treat menstrual cramps. Diclofenac powder or Cambia is used to treat a migraine headache attack. Cambia will only treat a headache that has already begun. It will not prevent headaches or reduce the number of attacks.
Diplusinal, brand name Dolopid. It is used to treat mild to moderate pain, osteoarthritis, and rheumatoid arthritis. Usual adult dose for pain is 1000 mg orally one time. Maintenance is 500 mg orally every 12 hours. Florbiprofen. No brands available. It is used to treat pain or inflammation caused by osteoarthritis and rheumatoid arthritis. Side effect is constipation, diarrhea, dizziness, drowsiness, headache, heartburn, nausea, stomach upset, or stuffy nose. Usual adult dose is 200 mg to 300 mg orally per day in 2 to 4 divided doses. Maximum single dose is 100 mg. Itodolac, brand name Lodin XL, used to treat mild to moderate pain, osteoarthritis, or rheumatoid arthritis. Side effects: vomiting, nausea, stomach ache, indigestion, diarrhea, constipation, dizziness, weakness, sore throat, flu symptoms, runny nose, itching, rash, or headache. Usual adult dose, capsule or tablets, 200 to 400 mg orally every 6 to 8 hours. One should not exceed 1,200 mg. Ibuprofen, brand name Advil, Genpril, Midol IB, Montrin IB, Propranolol, SmartSen, Children's Ibuprofen. Ibuprofen is used to reduce fever and treat pain or inflammation caused by many conditions such as headache, toothache, back pain, arthritis, menstrual cramps, or minor injuries. Ibuprofen is used in adults or children who are at least 6 months old. Signs of an allergic reaction to ibuprofen are sneezing, stuffy or runny nose, wheezing or trouble breathing, swelling of your face, lips, tongue, or throat. Usual adult dose for pain, for oral, mild to moderate pain, is 200 to 400 mg orally every 4 to 6 hours as needed. Doses greater than 400 mg have not been proven to provide greater efficacy. For intravenous, patients should be well hydrated before intravenous ibuprofen administration. For pain, 400 to 800 mg intravenously over 30 minutes every 6 hours as needed. For headache, ECT or prevention of electroconvulsive therapy induced headache, 600 mg orally 90 minutes prior to ECT session. Indomethacin, brand name Indocin SR, Tiberbex. Indomethacin is used to treat moderate to severe osteoarthritis, rheumatoid arthritis, gouty arthritis, or ankylosing spondylitis. And indomethacin is also used to treat shoulder pain caused by bursitis or tendinitis. Extended release indomethacin should not be used to treat gouty arthritis. Signs of an allergic reaction are sneezing, stuffy or runny nose, wheezing or trouble breathing, swelling of your face, lips, tongue, or throat. Adult dose for pain is 20 mg orally 3 times a day or 40 mg orally 2 to 3 times a day. Ketoprofen, brand name Orodis, Orovil, Actron, Orodis KT. Ketoprofen is a non-steroidal anti-inflammatory drug. It works by reducing hormones that cause inflammation and pain in the body. It is used to treat pain or inflammation caused by arthritis. The ketoprofen capsule, regular capsule, is also used to treat mild to moderate pain or menstrual pain. Only ketoprofen extended release capsule are used to treating arthritis. This form of ketoprofen will not work enough to treat acute pain. Side effects: indigestion, nausea, stomach pain, diarrhea, constipation, headache, insomnia, feeling nervous or swelling of your hands or feet. Adult dose for pain, immediate release 25 to 50 mg orally every 6 to 8 hours. Maximum dose is 300 mg per day. Nabumetan, brand name Relapen. Nabumetan is a non-steroidal anti-inflammatory drug. It works by reducing hormones that cause inflammation and pain in the body. It is also used to relieve the symptoms of rheumatoid arthritis or osteoarthritis. Side effects: stomach pain, indigestion, nausea, diarrhea, constipation, headache, dizziness, itching, skin rash, or ringing in your ears. Adult dose for osteoarthritis or rheumatoid arthritis: initial dose 1000 mg orally once a day. Maintenance 1500 to 2000 mg orally per 1 or 2 divided doses. Maximum dose is 2000 mg per day. Naproxen. Brand names: Easy Naproxen, Planax, Midol Extended Relief, Naprelan 375, and Naproxen. Naproxen is a non-steroidal anti-inflammatory drug. It works by reducing hormones that cause inflammation and pain in the body. It is used to treat pain or inflammation caused by conditions such as arthritis, ankylosing spondylitis, bursitis, tendinitis, or menstrual cramps. The delayed release or extended release tablets are slower acting forms of naproxen that are used only for treating chronic conditions such as arthritis or ankylosing spondylitis. These forms will not work fast enough to treat acute pain. Side effects may include nausea, stomach pain, heartburn, indigestion, headache, drowsiness, dizziness, itching, rash, swelling, or ringing in your ears. Adult dose for pain: immediate release for naproxen sodium 500 mg, 550 mg orally, followed by 275 orally every 6 to 8 hours, or 550 mg orally for 12 hours. Maximum dose is 1375 mg per day. Initial total daily dose. Oxaproxen, brand name Daypro. Oxaproxen is a non-steroidal anti-inflammatory drug. It works by reducing hormones that cause inflammation and pain in the body. It is used to treat pain or inflammation caused by osteoarthritis or rheumatoid arthritis in adults. It is also used to treat rheumatoid arthritis in children who are at least 6 years old. Side effects: constipation, diarrhea, dyspepsia. Dyspepsia is a pain in the stomach caused by difficulty in digesting food, and nausea, skin rash. Adult dose for osteoarthritis: loading dose is 1200 mg to 1800 mg orally. Maintenance 1200 mg orally once a day. Maximum dose 1800 mg or 26 mg per kilogram orally per day. Piroxicam, brand name Peltin. Piroxicam is a non-steroidal inflammatory drug used to treat rheumatoid arthritis or osteoarthritis. Exactly how it works is not known. It may block certain substances in your body that link to inflammation. Side effects: constipation, diarrhea, dizziness, headache, vomiting, heartburn, nausea, stomach pain, or stomach upset. Recommended adult dose for rheumatoid arthritis: 20 mg orally once a day. Sulindac, brand name Clinovil. Sulindac is a non-steroidal anti-inflammatory drug. It works by reducing hormones that cause inflammation and pain in the body. It is also used to treat pain or inflammation caused by arthritis, ankylosing spondylitis, tendinitis, bursitis, or gout. Common side effects of Sulindac may include nausea, vomiting, stomach pain, indigestion, loss of appetite, diarrhea, constipation, headache, dizziness, drowsiness, rash, or itching. Adult dose for rheumatoid arthritis, initial dose 150 mg orally twice a day, maximum dose 400 mg orally per day. Tolmentin. Brand name Tolectin, Tolectin DS, Tolectin 600. Tolmentin is a non-steroidal anti-inflammatory drug. It works by reducing hormones that cause inflammation and pain in the body. It is used to treat pain and inflammation caused by osteoarthritis or rheumatoid arthritis. Tolmentin is also used to treat rheumatoid arthritis in children who are at least 2 years old. Common side effects of Tolmentin may include indigestion, stomach pain, nausea and vomiting, diarrhea, headache or dizziness, weakness or changes in weight. Usual adult dose for rheumatoid arthritis 400 mg orally 3 times a day. Maintenance 600 to 1,800 mg in 3 divided doses. Maximum dose is 1,800 mg per day. Next is the disease-modifying anti-rheumatic drugs or DMARDs. It is a group of medications commonly used in patients with rheumatoid arthritis. Some of these drugs are also used in treating other conditions such as ankylosing spondylitis, psoriatic arthritis, and systemic lupus erythematosus. They work to decrease pain and inflammation, to reduce or prevent joint damage, and to preserve the structure and function of the joints. First is the abitacept. Abitacept brand name is Orencia Click Check, Orencia Prefilled Syringe. Abitacept is a protein that prevents your body's immune system from attacking healthy tissues such as joints. Abitacept is also used to treat symptoms of rheumatoid arthritis and to prevent joint damage caused by this condition. This medicine is for adults and children who are at least 2 years old. Abitacept is not a cure for any autoimmune disorder and will only treat the symptoms of your condition. Usual adult dose for rheumatoid arthritis for intravenous. If a person is less than 60 kg, give 500 mg. If 60 to 100 kg, give 750 mg. If greater than 100 kg, give 1000 mg. Administer once as a 30-minute intravenous infusion. The dose is repeated 2 and 4 weeks after the initial dose, then 4 weeks thereafter. It may be administered alone or with DMARDs other than TNF antagonists. For subcutaneous infusion, after a single dose of intravenous infusion as a loading dose, 125 mg, administered by subcutaneous infusion should be given within a day, or 125 mg subcutaneously once a week. Patients who are unable to receive an infusion may initiate weekly injections subcutaneously without an intravenous loading dose. Next is the chloroquine and hydroxychloroquine. Mechanism of action: non-biological drug used mainly for malaria. Pharmacokinetics: rapidly absorbed and 50% protein bound in the plasma. Deaminated in the liver and have blood elimination, half-lives up to 45 days. Indication: not considered very effective. DMARDs 6.4 mg per kilogram hydroxychloroquine or 200 mg chloroquine takes 3 to 6 months to obtain a response. Decrease mortality and skin manifestation and cirrhosis, a joint pain of the disease. Adverse effects: dyspepsia, nausea, vomiting, abdominal pain, rashes, and nightmares. Next is the cyclophosphamide for oral and injection. Brand name: Cytoxan, Cytoxan Globalized, and Neosar. Cyclophosphamide is a cancer medication that interferes with the growth and spread of cancer cells in the body. It is used to treat several types of cancer. It is also used to treat certain cases of nephrotic syndrome or kidney disease in children. Side effects of cyclophosphamide may include nausea, loss of appetite, stomach pain, upset stomach, diarrhea, temporary hair loss, a wound that will not heal, missed menstrual periods, changes in skin color or nails.
Leflunomide affects the immune system and reduces swelling and inflammation in the body. It is used to treat the symptoms of rheumatoid arthritis. Common side effects may include nausea, diarrhea, stomach pain, headache, abnormal liver function tests, thinning hair, back pain, weakness, rash, or high blood pressure. Mycophenolate mofetil is an immunosuppressant. Your body may reject an organ transplant when the immune system treats the new organ as an invader. An immunosuppressant helps to prevent this rejection. Mycophenolate mofetil is used to prevent your body from rejecting a kidney, liver, or heart transplant. This medicine is usually given with cyclosporine and steroid medicine. It may also be used for purposes not listed in this medication. Side effects may include nausea, vomiting, diarrhea, swelling in your ankles or feet, or high blood pressure. Sulfasalazine affects a substance in the body that causes inflammation, tissue damage, and diarrhea. It is also used to treat moderate to severe ulcerative colitis. Sulfasalazine is also used to treat rheumatoid arthritis in children and adults who have used other arthritis medicine without successful treatment or symptoms. Common side effects: tocilizumab reduces the effects of substance in the body that can cause inflammation. It is used to treat moderate to severe rheumatoid arthritis in adults. It is sometimes given together with other arthritis medicine. Tocilizumab is used to treat systemic juvenile idiopathic arthritis or Still's disease in children who are at least 2 years old. It is sometimes given together with methotrexate or rheumatotrexal. It is also used in adults to treat giant cell arthritis or inflammation of the lining of your arteries from your heart to other parts of the body. Okay?
Tocilizumab is usually given after other medicines have been tried without successful treatment of symptoms. Side effects may include runny nose or stuffy nose, sinus, pain, sore throat, headache, high blood pressure, anxiety, confusion, shortness of breath, uneven beats, or pain, swelling, burning, or irritation around the IV needle or where an injection was given. Adalimumab reduces the effects of a substance in the body that can cause inflammation. It is used to treat rheumatoid arthritis, juvenile idiopathic arthritis, psoriatic arthritis, ankylosing spondylitis, plaque psoriasis, and chronic skin condition called hidradenitis suppurativa. It is used to treat Crohn's disease or ulcerative colitis after other drugs have been tried without successful treatment of symptoms. Side effects may include headache, cold symptoms such as stuffy nose, sinus pain, sneezing, sore throat, rash or redness, bruising, itching, or swelling where the injection was given. Certolizumab reduces the effect of a substance in the body that can cause inflammation. Certolizumab is used to treat the symptoms of Crohn's disease after other drugs have been tried without success. It is also used to treat moderate to severe rheumatoid arthritis in adults. Side effects may include pain or burning when urinate, rash or cold symptoms such as stuffy nose, sneezing, and sore throat. May tumatawag. Etanercept is a tumor necrosis factor or TNF blocker. It works by decreasing TNF, a protein produced by the immune system to help the body fight infection. In people with autoimmune disorders, the immune system produces too much TNF and mistakenly attacks healthy cells. Etanercept is used to treat the rheumatoid arthritis, psoriatic arthritis, or ankylosing spondylitis. And to prevent joint damage caused by these conditions, etanercept is also used to treat polyarticular juvenile idiopathic arthritis in children who are also at least 2 years old. It is also used to treat plaque psoriasis in adults and children. Side effects may include pain, swelling, itching, or redness where the medicine was injected, headache or cold symptoms such as stuffy nose, sneezing, or sore throat. Golimumab reduces the effects of a substance in the body that can cause inflammation. Golimumab is used to treat rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, or ulcerative colitis. Golimumab is sometimes used with another medicine called methotrexate or reumatrexal. Side effects may include cold symptoms such as stuffy nose, sneezing, or sore throat, flu symptoms, cold sores, or pain, itching, redness, or swelling where you injected the medicine. Infliximab is used to treat rheumatoid arthritis, psoriatic arthritis, ulcerative colitis, Crohn's disease, and ankylosing spondylitis. Infliximab is also used to treat severe or disabling plaque psoriasis. It is often used when other medicines have been not effective. Side effects may include stuffy nose, sinus pain, sore throat, cough, headache, or stomach pain. Tofacitinib works by blocking certain enzymes in the body that affect immune system function. It is used to treat moderate severe rheumatoid arthritis in adults who have tried methotrexate without successful treatment of symptoms. Tofacitinib is sometimes given in combination with arthritic medicines. Side effects may include headache, diarrhea, or cold symptoms such as stuffy nose, sneezing, or sore throat. Anakinra is used in newborn babies to treat rare genetic condition called neonatal onset multisystem inflammatory disease, or NOMID. NOMID is a form of crypirine-associated periodic syndromes, or CAPS. This condition causes uncontrolled inflammation in many parts of the body, including the skin, joints, and central nervous system. Side effects may include worsening of rheumatoid arthritis symptoms, nausea, vomiting, diarrhea, stomach pain, headache, joint pain, flu symptoms, cold symptoms such as stuffy nose, sneezing, sore throat or redness, bruising, pain, or swelling where the injection was given. Canakinumab is a monoclonal antibody that blocks certain proteins in the body that can affect inflammation in other immune responses. It is used to treat certain types of periodic fever syndromes, sometimes called autoinflammatory syndromes. Periodic fever syndromes are rare and often inherited conditions caused by mutation in certain genes, usually genes that are involved in producing a certain protein or enzyme in the body. People with a periodic fever syndrome have episodes of fever and inflammation without other causes such as infection or virus. Canakinumab is used to treat the following periodic fever syndromes in adults and children who are at least 4 years old. Cryopyrin-associated periodic syndromes, or CAPS, include familial cold, autoinflammatory syndrome, and Miclat syndrome. Tumor necrosis factor receptor-associated periodic syndrome, or TRAPS, hyperimmunoglobulin D syndrome, or HIDS, also called mevalonate kinase deficiency, or MKD, familial Mediterranean fever, or FMF. Canakinumab is used to treat sudden juvenile idiopathic arthritis, or SJIA, in children who are at least 2 years old. Side effects may include flu symptoms, cold symptoms such as runny nose, cough, sore throat, nausea, vomiting, diarrhea, headache, body aches, dizziness, spinning sensation, or itching, dizziness, swelling, or warmth where the medicine was injected. Rilonacept is used to treat some of the symptoms of rare genetic conditions such as familial cold autoinflammatory syndrome, or FCAS, or Miclat syndrome, or MWS. FCAS and MWS are inflammatory disorders in which the body develops certain symptoms without a known cause, such as virus, bacteria, or illness. These symptoms include fever, chills, fatigue, and other pain. More serious symptoms may involve the bones and joints, the central nervous system, deafness, vision loss, mental impairment. Rilonacept may treat or prevent the symptoms of familial cold autoinflammatory syndrome, or Miclat syndrome. However, this medicine is not a cure for these inherited conditions. Side effects may include cold symptoms such as stuffy nose, sneezing, cough, sore throat, nausea, stomach pain, diarrhea, numbness or tingling feeling, or pain, swelling, redness, itching, warmth, blistering, bleeding, or other irritation where the medicine was injected. Belimumab is monoclonal antibody that affects the actions of the body's immune system. Monoclonal antibodies are made to target and destroy other certain cells in the body. This may help to protect healthy cells from damage. Belimumab is used to treat active systemic lupus erythematosus, or SLE, in adults. It is not used in use for people who have severe kidney problems caused by SLE or have active SLE that affects the central nervous system like brain, nerves, and spinal cord. Side effects may include nausea, vomiting, diarrhea, stomach pain, urination problems, fever, sore throat, runny or stuffy nose, cough, pain in your arms or legs, headache, depressed mood, or sleep problems, or insomnia. Glucocorticoid drugs are a type of corticosteroid hormone known for their potent inflammatory and immunosuppressive effects. Glucocorticoids are secreted naturally by our adrenal gland in response to adrenocorticotropic hormone, which is secreted from the anterior pituitary gland in response to stress. Other analgesics includes acetaminophen. It is a pain reliever and fever reducer. Acetaminophen is used to treat many conditions such as headache, muscle aches, arthritis, backache, toothaches, colds, and fevers. Side effects may include nausea, upper stomach pain, itching, dark urine, clay-colored stools, or jaundice, yellowing of the skin or eyes. Ketorolac is a non-steroidal anti-inflammatory drug or NSAID. This medicine works by reducing substance in the body that cause pain, fever, and inflammation. Ketorolac nasal for the nose is used short-term or for 5 days or less to treat moderate to severe pain. Common side effects may include pain or irritation in your nose, runny nose, watery eyes, throat irritation, or mild rash. Tramadol is a narcotic-like pain reliever. Tramadol is used to treat moderate to severe pain. The extended-release form of tramadol is for around-the-clock treatment of pain. This form of tramadol is not for use or on as-needed basis for pain. Side effects may include headache, dizziness, drowsiness, tired feeling, constipation, diarrhea, nausea, vomiting, stomach pain, feeling nervous or anxious, itching, sweating, flushing, or warmth, redness, or tingling feeling. Drugs used in gout includes colchicine. It affects the way the body responds to uric acid crystals, which reduces swelling and pain. Because colchicine was developed prior to federal regulations requiring FDA review of all marketed drug products, not all uses of colchicine have been approved by the FDA. The Colchis brand of colchicine is FDA approved to treat or prevent gout in adults and to treat a genetic condition called familial Mediterranean fever in adults and children who are at least 4 years old. The Mighty Gear brand of colchicine is FDA approved to prevent gout flares in adults. Generic forms of colchicine have been used to treat or prevent attacks of gout or to treat symptoms of Behçet syndrome, such as swelling, redness, warmth, and pain. Colchicine is not a cure for gouty arthritis or Behçet syndrome, and it will not prevent this disease from progressing. Colchicine should not be used as a routine pain medication for other conditions. Side effects may include nausea, vomiting, stomach pain, or diarrhea. Indomethacin is a non-steroidal anti-inflammatory drug in gout that works by reducing hormones that cause inflammation and pain in the body. Indomethacin is used to treat moderate to severe osteoarthritis, rheumatoid arthritis, gouty arthritis, or ankylosing spondylitis. Indomethacin is used to treat shoulder pain caused by bursitis or tendinitis. Extended-release indomethacin or indocin XR should not be used to treat gouty arthritis. Side effects may include upset stomach, nausea, vomiting, diarrhea, constipation, headache, dizziness, drowsiness, feeling tired or depressed, or ringing on your ears. Allopurinol reduces the production of uric acid in your body. Uric acid buildup can lead to gout or kidney stones. Allopurinol is used to treat gout or kidney stones and to decrease levels of uric acid in people who are receiving cancer treatment. Side effects may include vomiting, diarrhea, drowsiness, changes in your sense of taste, or muscle pain. Febuxostat reduces the production of uric acid in your body. Uric acid buildup can lead to gout or kidney stones. Febuxostat is used to treat gout. Side effects may include nausea, joint pain, swelling or stiffness, mild skin rash, and dizziness. Prednisone is a type of glucocorticoid or glucocorticosteroid. It prevents the release of substance in the body that cause inflammation. It also suppresses the immune system. Prednisone is used as anti-inflammatory or an immunosuppressant medication. Prednisone treats many different conditions such as allergic disorders, skin conditions, ulcerative colitis, arthritis, lupus, psoriasis, or breathing disorders. Side effects may include sleep problems or insomnia, mood changes, increased appetite, gradual weight gain, acne, increased sweaty, dry skin, thinning skin, bruising or discoloration, slow wound healing, headache, dizziness, spinning sensation, nausea, stomach pain, bloating, changes in the shape of or local body fat, especially in your arms, legs, face, neck, breast, and neck.